All right, welcome back to the Scott Godwin channel. We're going to talk a little bit this morning about hip pain. We're going to talk about a couple of quick things you can do to make your hips feel better. Okay, you can take muscles and you can stretch them like this, okay, from one end to the other and pull on them, say your hamstrings or your biceps, and that's good. I mean, it's stretching out the full length of the muscles. But you can also manipulate, press on different points within the muscle to stretch it as well, so you can stretch to the touch. So what we're going to do today is we're going to use a foam roller right here, as well as a medicine ball to stretch the hips. Okay, and I'm going to show you a couple things you can do. What happens over time is the joints get stiff from sitting too much. These big hip joints, they get stiff from trauma, from injuries, from sitting too much, just wear and tear, aging. So what we're going to do is we're going to use this to basically dig in and touch the joints and stretch using these tools, which will allow us to stretch in a different way than elongating the muscles of the hips, okay? So I'm just going to run through just a couple things. This is a foam roller. You can buy this at, you can get it at Target, Walmart, any sporting goods store. Costs maybe $20. You can get a soft one or you can get a hard one. I like the hard ones. They just dig in there better and stretch better. So this is a hard one. I'm going to show you a couple things you can do with it. And then we've got a medicine ball too. You can use a basketball medicine ball, and this is just a little bit harder, a little more pinpointed. So we'll run through a couple things, foam roller, and then we'll use the medicine ball. So the first one we're going to do is working on the glutes, just working on the butt. Okay, the butt gets tight. You particularly get tight on the outside of the hip back here from sitting a lot. And so what we're going to do is use the roller to just go in and just dig around. And so what I'm going to do is I'm going to put this foot here, and I'm going to put this leg straight out like so, and I'm going to roll about 10 times right down the side of the hip, okay? Stretching the glute medius, glute maximus, getting deep into the hip joint, okay? We're increasing blood flow, and we're looking for what's called trigger points, tight little spots within the muscle. If you find a spot that's really tender, let it sit, let it marinate, and let it sit 10 to 30 seconds, just like a static stretch, and then just keep rolling, okay? So that's the outside of the hips, just like that. Now you can do the exact same thing with the medicine ball. Okay, same leg position, the opposite knee is bent, the leg on the same side is straight, and just roll that around. Man, that feels good, okay? So if your back is stiff, your hips are stiff, even if they're not, just to prevent stiffness, and to stretch in a different way, try that, okay? Try it on both sides. Okay, now let's talk about the hip flexors, okay? That's these muscles right here on the front of the hip. Now watch what I do. I'm just gonna come down on my forearms, place the ball right at the top of my hip, and same thing. I'm gonna roll 10 times, and then I'm gonna look for trigger points, look for knots, look for tight spots. I do this quite a bit, so right now I don't have any trigger points, so I'm just doing the rolling. But if I were to find a spot, I would let it sit, marinate for about 10 to 30 seconds. Okay? Just like that. So I've got this knee on the ground, I've got my core tight to stabilize my back, and I'm just rolling, just like so. Okay? Now, let's talk about the angles that you're rolling. Okay, this is a straight line. This is very linear, right? When you're rolling, I want you to move left and right, okay, just like this, and forward and backward, linear at the same time, okay? So you're going to be moving in these different planes. You're going to be moving three-dimensionally, and that will allow you to get a more versatile stretch on the joint. It'll allow you to explore the stretch better. When you stretch, explore the stretch. Feel it. Look at it from different angles, okay? Feel it from different angles. So here we're moving forward and backward, but we're also moving laterally like this, okay? See that? And then we're doing it all at the same time, okay? And it really allows us to explore the stretch, okay? So you can do that with the roller or with the medicine ball. So we got, that's the hip flexors, okay? The front of the hips. We did the side of the hips, we did the front of the hips. Now let's try the inside of the hips, lastly. Now I'm gonna go back to my foam roller. You can do any of these with the foam roller or with the medicine ball. Either one would be fine. But now we're gonna work on the adductors, the inside of the hips, okay? This one's a little bit trickier position-wise, but what you're gonna do, place the foam roller facing this way, linear. You're gonna come out, kind of sprawl out to the side, get it down inside your thigh like this, and then just roll, okay? And again, you wanna move in all different planes. You're gonna move out like this, you're gonna move forward a little bit, okay? So different angles, just rolling like so. You find a tender spot, a tight spot, you want to let it sit and hold, okay? Marinate 10 to 30 seconds, okay? But again, I've got my forearms down, my core is tight, so I'm not putting too much pressure on my back, and I'm just rolling, just like so, okay? So, you could use the roller to do that, you could use the medicine ball to do it, okay? So I'm going to put the medicine ball here, I'm going to roll in, it feels very good, okay? Really a different type of stretch than stretching out like this, okay? So a traditional stretch to stretch the inside of the hip would be like this, but all I'm doing is I'm taking that band of muscles and I'm pulling from one end to the other. If I use my implements to stretch, I'm pushing in, I'm rolling the muscles, it's different, okay? We're increasing nutrition, we're working on those tight little tender spots, and we're rolling it out, stretching it a different way. So if you have hip pain, back pain, joint pain, try those things, the outside of the hips, the inside of the hips, the front of the hips. Try that for your hips, and both your hips and your back may feel better. But remember, start slow, start with a soft foam roller, build up to where you can use a medicine ball. It's much more pinpointed. It's more difficult because it's really pressing in there. It's a much more intense stretch. So try those, let me know how it goes, and we'll see you soon. Happy 2017.